Hi, YouTubers. Something important, something kind of damn important. So, it's Medical Thursday right now. So, Medical Thursday, like big ass here right now. So, obviously not a doctor for the last damn time. So, anyway, talking about this right now, cancer and hair loss. How do they relate? So, it's very damn common for people who have cancer treatment, like chemotherapy and radiation, to have hair loss. Now, this is a very damn common side effect. Actually, it's a very stereotypical side effect because most people, when they think of people who are cancer patients, lung cancer, breast cancer, ovarian cancer, etc., it's very damn common to think of hair loss because most people picture a cancer patient with no hair and also other side effects. So it's the most common, one of the most common side effects from chemotherapy. Now, contrary to popular belief, not all chemotherapies, not all chemos cause hair loss. It's only certain types. So there are certain types. Chemotherapy is a drug, just like any kind of drug in general, and there are certain chemotherapies that always cause hair loss, and then there are certain chemotherapies that don't cause hair loss. So it depends on which type. Now, the most common cancers, like lung cancer, breast cancer, ovarian cancer, for example, pancreatic cancer, the chemotherapy that's used for those type of cancers, yes, will always cause hair loss because it's a certain type that's used to treat those cancers, but it's not always the case. So contrary to popular belief, not all chemotherapies cause hair loss. Now, what can be done about it? Not a whole lot, unfortunately. The part that really sucks, is unfortunately you kind of have to wait for your hair to naturally grow back, assuming you survive the cancer. It's like, there's a lot of people with lung cancer who end up succumbing to the cancer and end up dying, which is really, really sad, really fucking sad. But it's like, if you do survive the cancer, you are a survivor of breast cancer or lung cancer or colorectal cancer or leukemia. Basically, your hair, I think, in a lot of cases, I'm obviously not a doctor, I'm not a freaking doctor, it's like, I'm not giving you medical advice, it's like, so in a lot of cases, your hair will be able to naturally grow back and will be able to regenerate itself, but it will take time. It's not like just like buzzing your hair with a razor and, oh yeah, in like 3 months it'll grow back. The cells, obviously I'm not a doctor, but the cells are damaged, so they have to have time to regenerate. Same thing with like oral cancer, for example. When you get radiation to your head and neck, it affects the salivary glands in your head and neck, and sometimes the salivary glands will start working again after treatment, but not always. So that's kind of the thing is like, some people with, like mouth cancer, throat cancer, will eventually get saliva back and will eventually get their sense of taste and smell back. Not all of them will. Some of them will never get saliva back, and some of them will never get their taste and smell back. Some of them will even have their tongues removed from the cancer through surgery. And same thing with hair loss. It's like, some people will get all their hair back eventually in a matter of a couple of years. It really depends. And obviously, I'm not giving you any kind of advice. I'm not giving you any kind of false hope. So please don't quote me on this. Please don't say, oh, you must be a doctor smoking acid. You must be like a medical professional. You must have gone to like medical school. Like you must be an oncologist. No way. Bullshit. This is purely general information about cancer. So I'm just telling you what I've read online through different articles and stuff. So the bottom line about cancer and hair loss, because it's a very touchy subject, it's a very sensitive subject, because a lot of people, especially women, are very sensitive about it because women don't like, not having hair, obviously. It's like, for some people it will come back, some people it will never come back, some people will take a significant time for their hair to grow back, and that's why a lot of women choose to wear a wig, especially breast cancer patients, lung cancer patients, colorectal cancer patients. They will wear a wig because it's very, very sensitive for a woman to be bald because it's just not a natural look for most women. So that's the whole freaking point. I didn't want to start like a big debate. I didn't want to start like a big angry debate about this. I know it's a very touchy subject. I know it's a very sensitive subject because a lot of people are very sensitive about hair loss from cancer treatment. I just want to give you my my personal belief and my personal input. And obviously I'm not a fucking doctor for the last time. I really want to emphasize that I'm not a doctor. I'm not a nurse. I'm not any kind of professional. So this is just purely general information. So anyway, bye.